Hello, and welcome to another episode of the UIC Urban Health Hotline Show. My name is Tarri Strickland, and I will be hosting today's show. Today, our guest is Dr. Janice Phillips. She is one of the fabulous UIC alumni from the UIC College of Nursing, and we're so happy that she is here joining us today. Thank you for sharing the table with me today.
Thank you for having me.
Thank you. We were able to actually have some great conversation even prior to starting about nursing and the transition when it comes to our young folks and making the transition from undergraduate to whatever that may be, master's level, the doctorate level, so on and so forth. Can you talk a little bit about what your journey looked like?
Oh, it's been fabulous. How much time do we have? Just joking. It's been fabulous. You know, I've been a nurse since 1976. When I finished, I went right into a major medical center, loved it, and really fell in love and found my niche when I went into emergency nursing.
Okay.
I've seen everything. I've taken care of every single kind of patient from every single walk of life, from homeless people to dignitaries. I've seen it and I've done it. It's been absolutely wonderful. And at that time, I had just had a 4-year degree, a baccalaureate a degree in nursing, and had basically kind of swore off going back to graduate school. As many of your listeners and viewing audience will know, nursing school is tough. It can be tough, but it's very rewarding when you finish and get out on your own. And then I went back and pursued a master's degree. Okay. Compliments of the University of Chicago Medical Center. At that time, they were providing 100% tuition reimbursement. So I decided to take full advantage of that.
Okay.
Despite the fact that I didn't want to go back to school, but hey, I did. And then moved from the clinical setting to the community setting and worked on the west side of Chicago, had a great time with that, and then went back to work in the community on the south side. And that's when I really found my niche, when I started working with women, particularly low-income women, to try to get them to be screened for breast and cervical cancer. Okay. So it's that experience that I consider to be probably the most pivotal point in my career, because working in the community and working with underserved women and trying to understand why they would or would not be screened for cancer was the reason why I decided to go and pursue a doctorate. Again, that was not on my list of things to do. And I went to the University of Illinois College of Nursing, was fully funded, and did my research on breast cancer disparities, and then got out of my comfort zone and moved to the East Coast and had a fabulous time teaching at the University of Maryland and then working at the National Institutes of Health, which is our largest biomedical research organization in this country. And had a great time there, and came back home in 2005 and went back to the University of Chicago to help them achieve magnet recognition.
Wow. And
then I got a little restless again, and then I went to pursue a health policy fellowship on Capitol Hill.
No, that's a journey.
Yeah, it's been fabulous.
Oh my goodness.
It has been fabulous.
When you talk about lifetime learning,
yeah,
you are the epitome of a lifetime learner. Wow. When it comes to our students, I hope you all are taking heed to this. It's not just about, oh, I'm going to get my undergraduate degree and it's over. No, it's a lifetime of, what is it? Finding your niche, finding your journey, finding your passion in life, and making that happen. I'm sure there were things during your journey that you might want to share with us, where there's some mentors, where there's some shadowing experiences that you can maybe share with us.
I wholeheartedly believe that nobody gets to where they are unless somebody helps them. You know, you probably read the alumni story about me growing up in foster care.
Yes.
And my first real taste of mentoring was from my social worker, who basically saw something in me that said, you know what? She actually used the word, she's got potential. And I didn't even know what potential meant, but it sounded pretty good. But she made sure that I got to college and I got through just fine. So I credit Anna Mae Earls, a former DCSF social worker, as my first formal mentor. And then, of course, there have been other individuals along the way, professors, colleagues, very distinguished nurse leaders who have given very generously of their time and their support. So, again, I don't believe anybody gets to where they are unless somebody helps them. You need mentoring for different stages of your career. You might need a different kind of mentor when you're in school. When you graduate, there might be another kind of mentor. When you launch your professional path, you might need a different kind of mentor. Depending on if you change your specialty or your focus in nursing, you may have to find another mentor. And even now, after so many decades of nursing, I'm looking forward to my next set of mentors.
Okay.
I'm at a different phase in my career. I'm now trying to pursue more opportunities in the health policy arena. So this will require a new kind of mentor.
Yes.
But also, too, just as I have been mentored, I have a responsibility to mentor somebody.
Oh, yes.
So we don't want to forget that we've got to kind of give back as a result of what we've received as well.
I'm so glad you mentioned that. With a lot of the UHP alumni as yourself, you're always giving back, whether that is sitting next to me, sharing your experiences with our callers, with our students, talking about what is going on with policy, talking about health careers, things that you guys here can be doing in order to advance your careers.
Absolutely.
What an experience, what a talk that can be had from future alums, future physicians, future scientists.
Yeah.
It just gets us so excited.
Yeah, pretty cool stuff. Yeah.
When you talk about mentoring, I wanted to pause for a minute because being an academic skills specialist, a lot of the students are always saying, how do I approach a mentor? Is it something, do I call folks? Do I just look online for a name? Is there someone that I should talk to? Do you have any advice on how students, especially the undergraduate students, should go about approaching professionals, faculty, to get them to be their mentor?
I think it's really important that starting out we watch people. Watch how they carry themselves. What is it about them that you want to shadow or that you want them to serve as your mentor? How have they interfaced with other students? So kind of do that assessment first.
Okay.
Many individuals that I have encountered are very happy to help or to mentor. Sometimes they are so overwhelmed with their current caseload of mentees, they can't always mentor. And so we shouldn't take that personally.
Yes.
Sometimes it may not even be a very good match, but we still want to look and make that assessment and simply ask, I'm looking for a mentor. I'm looking for someone to kind of help me navigate my career. I've noticed you. I've watched you. I've read some of your publications. I've followed your career. Okay. You as a mentee bring something to the table as well. And so for those individuals who have the time and who are willing, they will mentor. But again, if someone doesn't have the time or they're not quite sure that they're ready to mentor someone else, don't be offended. Just continue to watch and monitor and move on to someone else. And the other thing that I've learned about nursing is that it's nice to have nursing mentors, but we don't want to forget that there may be other disciplines or other professionals who can help guide us as well.
Oh, yes. Oh, yes.
And keep in mind that as a mentee, we have a responsibility too. If our mentor says, here's a plan that we think we might want to follow, I will need to touch base with you every month or every 3 weeks, we need to honor that.
Yes. Yes.
And we also have to know that we bring something to the table as well. Many students have life experiences or they've got something that's going on that really makes them very unique. They're very intelligent. They have a body of expertise that may be beneficial to that mentor as well. So a lot of times we think it's all one-sided.
Yes.
But as a mentee, we have a responsibility to give and to receive.
I hope you guys are listening. Remember, this is a live call-in show, so please, please, please give us a call at 312-738-1060 because we're here with Dr. Janice Phillips because she has some great information for you all about the College of Nursing, about careers in nursing, and just about her journey when it comes to a professional degree, becoming a doctorate, You have all the information right here. Call us at 312-738-1060. That was some great advice about being a mentee, because a lot of our students, they get stuck in the, oh my God, that person didn't call me back, or they don't know how to have the conversations or feel that they're special enough to engage the faculty or engage anyone else. They just feel like, oh, I'm just sitting here listening. So it's great that you're setting these students up to say, hey guys, share your story. You are special. You are important. I actually wanted to change the stage and talk about, you have a book.
Yeah.
And it's called Accelerate Your Career in Nursing, A Guide to Professional Advancement and Recognition. So one, I want to congratulate you on having this book out. And two, let's talk about this, because the students need to know about this. They need to run out and get this book because it's coming out when, in
September the 3rd
okay.
of this year, yes.
So let's talk about this book. How do we guide the professionals? We talked about mentoring. Let's talk about some other guiding steps.
Yeah. So let me just tell you how this came about.
Okay.
I had a colleague, Janet Boyven, who many people in the nursing community already know. She was an editor for Nursing Spectrum many years ago, but she had taken on a new job at another institution, and she asked me, "Do you have any ideas for books?" I said, "Oh, I'll think about it." And then, I didn't get back to her. And then, this is the true story. When I was doing my health policy fellowship with the U.S. Senate, I was homesick one day, and I just started writing down little bits of information in what I call my idea notebook. Mm-hmm. And then I looked around, and then I had all of these ideas, and I thought, what would I want right now in my career? And what I wanted was one guidebook that I could just go to, rather than go to the internet and have to look at this side and that side and this side and go to that school and that school. And so I thought, what would someone need at this point in their career, whether they were just starting out or whatever point they would be in? And so Accelerate Your Career in Nursing, A Guide to Professional Advancement and Recognition, is really about how do we demonstrate our distinction of excellence. How do you package yourself? How do you document that? How do you successfully craft an application if you want to pursue your doctorate degree? How do you select people to write letters of nomination? You don't just go to anyone and say, I need a letter because I'm going to graduate school.
Yes. Oh, yes.
And you don't go the night before that letter is due. Right. So there's some pieces in there that talk about that. How do you land prestigious fellowships and internships? Because even though our students have formal education, sometimes those fellowships and internships give them a very special experience. So how do they find those types of experiences? How do they craft those applications? And then there's a section in there about how to act powerfully, which to me is very significant, because sometimes I don't think that we always carry ourselves in a very confident manner, and basically claiming our power as nurses, claiming our power as healthcare providers. We really have a lot of power to change, to influence, and to shape. We're right at the bedside with the patient and with the family. We, as nurses, know more about that patient and that family than probably anybody else who's ever laid eyes on that patient. So how do you claim that power to be that advocate for that patient? How do you claim your power in terms of trying to make sure that that patient or other patients have exactly what they need? How do you use your expertise and your education that you've received at UIC to kind of change the way care is delivered? So how to act powerfully, it talks about those types of things. And it starts with, how do we even address ourselves and each other?
That dialogue.
Yeah, exactly. So those little things that we don't necessarily pay attention to, but over time, collectively, they make a difference.
Okay. And it actually sounds as if I don't even really need to be a part of the nursing major. It sounds like this book would be helpful to anyone in any health professions area.
Yes.
It sounds like it speaks to if you want to be a pharmacist or policy, any health profession, this really talks to accelerating your just a career in health professions. Any student, if you need help, you need something support. This is a supportive book for you to take you to the next level.
And the section that's the resource section has information that anyone can use.
Okay.
How do you find the information? What are the credible sources? We're all bombarded with a lot of data and a lot of information. How do we catalog that? Mm-hmm. How do we receive information in a very accurate and synthesized manner? And so it talks about that as well.
Oh, it looks like we have a caller.
Good evening. Hello?
Are you there?
Yeah, I'm here, but the TV went blank. Okay, there you are. Now, I wanted to ask a question about your minority recruitment program. I saw you had a special not too very long ago for I think it was your pharmacy program, and there was a young lady by the name, I guess, a Princess or something like that. She was one of the, directors of that program, maybe?
Mm-hmm. Princess is the director for the College of Medicine.
Okay, so I was referring a young lady this summer who was home from a summer break from her freshman year at a Southern Illinois school, small school, and who's wants to go into nursing. I was trying to wanted her to get in touch with them, with your program. How can I put her directly in touch with someone over there in that minority recruitment program for nursing?
I'm going to give you a number. It's the main number. It's 312-996-7727, and you'll be able to speak with one of the academic skills specialists like myself in order to she can get more information on internships and so forth so that she can get on the right path.
Okay, and do you all provide mentors for youngsters coming in?
We do.
Transferring in?
Yes, we do.
Do you use one of the nursing organizations at all?
We actually use a lot of our alumni as Dr. Phillips. A lot of them come and they say we just want to volunteer and give time, whether that is providing a lunch, whether that is we want to have our students come and have a clinical experience at our hospital, or we want them to come in and just have a day-to-day if they're a dentist in our labs. So many things that our students can take advantage of, whether they are a UIC student or they're just a student in the community, high school age, or even younger.
Okay. Thank you so very much.
Thank you for calling. We have another caller. Are you there? Caller, are you there?
Yes.
Hello, caller. What's your question?
Yes.
What's your question?
I have an 18-year-old, and he's like, he's like a senior, and
You have a little echo on your phone. If you could turn down your TV just a little bit.
on your phone. If you could turn down your TV just a little bit. Okay, I have.
Thank you.
He's 18. He's a senior, and he's taking health clinic.
Well, I'm sorry, but it looks like we lost our caller. But she hopefully will call back. But it sounds like a lot of our students have the questions of they're 18, they're looking for that journey, what they need to do next. They're not sure about what they want to do. Call us. You can even call this number at the bottom of your screen, 312-738-1060, in order to connect you with the Urban Health Program in our main office. But we're winding down, so I want to know if there's any more questions for Dr. Phillips. But before we go, I have so many questions still for her, because with your making a difference, like you're known all across campus as the woman who makes a difference in lives. Can you give a story or an instance where you really felt as if you made a difference in a patient's life?
Oh, yeah.
Or memory.
Yeah. Oh, yeah. I've got so many experiences, particularly working in the emergency room at the University of Chicago Medical Center.
Okay.
Young women, for example, that would come in for a lot of gynae exams. We did a large number of gynae exams, and I thought, I wonder, do these women think that they're getting pap smears? And it's something that people probably don't even think about in the emergency room, because we did not do pap smears. So I started this campaign to educate women who were coming for gynae exams in the ER, to educate them about the notion, what is a gynae exam, but also the need for them to follow up and get an actual pap smear. Okay. So I went around and I put these wonderful posters in each of the exam areas, so that as people were getting their exams, they would really think about it. And then I created this discharge planning sheet, to check off of, these are the tests that you had today, but you need further up care in this particular area. And so it's a public health mission in an emergency room. So I always thought, well, you've got this attentive audience, why not take it a step further and try to educate them, because they're already here. They're already here.
Yes, it sounds like
that's just one of many.
I'm
examples.
sure, but you're a change maker, and I want you all to really understand that whether it is you interested in any of the health professions, but especially nursing, you guys are an agent of change. Whether it is the one-on-one interaction that you have with your clients, your patients, you make a change in folks' lives. And
absolutely. That's the most incredible thing about being in the health professions. I think we get to touch people's lives in ways that nobody else can touch. Nobody else can. And that's the beauty of nursing.
Oh, yes. And that's what a lot of physicians, they mention, that they don't get that moment because they are running to patient to patient to patient. But yet, if you are in the nursing side of the house, you can have that one-on-one intimate experience with your patient.
And our training is different, too, because we are basically educated to look at patients from a holistic and a comprehensive perspective. So we get into the psychosocial, we get into the emotional, we get into all of that. It's not just the hands-on physical care, and it's not just the patient only. It's the patient and their family or their network. So it's awesome, is all I can say.
Yes. Oh, yes. Yay. So I get excited, and I say yay, and I get so happy about these things. And I'm just so glad that we had Dr. Phillips here with us today with the Urban Health Program Hotline show. You guys know that we have so much to offer at the Urban Health Program, whether it is volunteer experience for you guys, internship opportunities. We are able to help you all, whether it is pharmacy, dentistry, the College of Nursing, medicine, School of Public Health, whether it's undergraduate admissions, whatever the help it is that you all are craving, UIC and UHP is able to help you all with that mission. So we want to thank you for watching our show today. It was so great that you all joined us. So many great questions, and we're thankful that you were here visiting us today.
Well, it's a blessing to be here. So thank you, and I have a world of gratitude, all world of gratitude to the University of Illinois. I really, really do.
Excellent. And we're so glad that alumni want to come back and they can share these excellent adventures, I say, with us and with the students, because you've come so far.
Oh, absolutely.
And the students need to see the journey.
Yes.
They need to see it, because this could be you. Yes. This could be you sitting next to me in a few years or next year discussing where you've been and where you're going.
And to recall every now and then it's not always easy, but you get through it with the help of many people.
Oh, yeah.
You get through it.
That's so true.
Yeah.
Yes. Thank you guys so much.
Thank you.
And it's been a great episode with you guys. Remember, we're here to provide you with internship, externship opportunities, volunteer programs, and remember, you can always be a mentor with us. So please, for more information on how to get involved in supporting UHP efforts, contact us at 312-996-7727.